Disclosures for this and all episodes in this series can be found on the podcast series destination page, located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast was developed through a strategic collaboration with the National Alliance on Mental Illness, supported by an independent educational grant from Takeda.
Hello, my name is Dr. Rakesh Jain, and I am a clinical professor in the Department of Psychiatry at Texas Tech University School of Medicine in Permian Basin. And everyone, welcome to this podcast episode, Depression Treatment, One Size Does Not Fit All. This is part of the 6-episode podcast series, What to Know About Depression. And today, I have the pleasure of speaking with Marty. And Marty, you and I have spoken before, but for our listeners, can you tell me a little bit more about yourself and your experience with depression, perhaps starting with when you were first diagnosed?
Sure, and thanks for having me on, and I'm very happy to share my story. I experienced my first major depressive episode when I was 17 years old, probably triggered by a move. I moved out on my own and started living in a new state, in a new area. One day I woke up and I was just tired. I felt exhausted. I felt like there was just a heavy weight on me. I didn't feel like I could get out of bed. Just something I'd never experienced before. I had no desire, drive to get up and even go anywhere except when I needed to go to the restroom. And that lasted for 3 days, basically. And it was then that I knew something was wrong, something was off, but I didn't know what. It was several years later before I actually had a formal diagnosis of major depression.
Gosh, so interesting. And thank you so much for sharing and for being so open with us, Marty. And that's a very impactful way to help kick off this important topic, because today we're talking about major depressive disorder, or MDD, or what we often just refer to as depression. And this is one of the most common mental health conditions in the United States. And in fact, up to 25% of adults can have depression at some point in their lifetime. But it can also happen in teens, like it happened in your case, Marty. And actually, sadly, it can even occur in children. And it is a mood disorder that causes feelings of sadness that won't go away, a loss of interest in things that you normally enjoy. And with this condition, people can feel depression most of the time for most of the days of a week, or at least 2 weeks in a row. And just like you, Marty, it can affect the way you function, the way you feel, the way you think, the way you act. Emotional and physical symptoms are part of the challenge. And it sounds like that was the case with you, Marty. So it can be a very complex condition and affects people in very different ways. And there can be a whole lot of symptoms, folks. You can have tiredness or lack of energy, as Marty talked about, or feeling sluggish or physically worn down, problems with sleep, problems with weight, problems with concentration, problems with the memory, problems with making decisions, and then, of course, sadness, irritability. It can be very challenging, and lots of things can kick it off. Sometimes it is a move, like it happened with you, Marty, or loss of a loved one, social isolation, maybe even trauma. So, Marty, after that first episode that you just talked about, what happened next?
Well, so I had moved, and by moving away from my hometown, I did lose my immediate social support, my peer group that I'd grown up with. I was away from family members, and I ended up going through several cycles of major depression. It became more obvious over time that the depression would last in not just 2 weeks, but in cases, months, and then alleviate a little bit. I would get better, think things were okay, and then it would start all over again. And so it took me a while to realize that this was an ongoing situation that wasn't fixing itself, so to speak. And finally, I did go seek treatment, not treatment for depression per se, but treatment just to find out what was wrong with me. I had no idea. I mean, I knew I was feeling sad. I knew what depression was, but I didn't think it was me, that it applied to me. And the thing that really broke it for me and made me decide that I really needed to do something is I had already begun missing a lot of classes in college, not doing the things I used to enjoy doing, avoiding friends, avoiding conversations, just hanging out in my room. And this was pre-video games, so you hung out with nothing or you read a book. And I began to self-medicate and I began to use alcohol. And I was not raised in a family of drinkers, so this was something new. And it was just waking up one morning on Sunday, getting ready to go to church and finding myself having 4 shots of rum so I would feel comfortable enough to go to church. That afternoon is when I went to an urgent care facility to find out what's wrong. Something's not right. So, and fortunately for me, over the course of the next 90 days, I was put on medication that did work. This was the first generation of antidepressants. And it took about 8 weeks before my depression alleviated in such a way that it was like taking a dark room and turning the light on. I woke up one morning just feeling invigorating, feeling a sense of lightness, both in lack of weight on my chest and lightness in the sense that nothing is gloomy anymore. Everything is bright. I knew then there was help, and I knew then that, yes, I had a problem with depression.
Wow, what a story. As you are sharing it with me and our listeners today, Marty, I am just so very moved. First of all, I am so sorry that as such a young person, just 17 or 18 years old, you had to deal with this. But you also highlighted the fact that often people with depression aren't quite aware of what's going on with them. And what you just shared with us, which is the use of alcohol to cope with it, is something I hear from a lot of people. And I must commend you for taking the right steps and seeking out help from healthcare providers. And I'm so glad your medication worked for you. And Marty, you are right. Depression is treatable. And it is so great that you're able to recognize that you were having an issue, that you needed professional help. And so glad the professionals were available to help you out and to put you on a path to finding a solution. Because obviously, our mental well-being is an important part of our overall health, isn't it? In fact, it probably is the central component of human life. So having an open and honest communication about our symptoms with our healthcare providers is going to be key to getting the care and treatment that's right for us. And because, as we said, depression is treatable, and the goals of treatment will be to control these symptoms and to flourish in life, I think a partnership with the healthcare providers is just so very important, because treatment will have to be individualized. Everyone's depression is different. Everyone's treatment plan could also be different. So in your case, Marty, sounds like your doctor recommended medications. And I suspect over time, your treatment plan evolved a little bit and that you worked with your doctor to find the right combination. Perhaps you can talk a little bit about that, please.
Yeah, and I agree with everything you said and would like to stress that depression, one, is treatable, but two, it's individual to each person. What works for one person may not work for the other person. And in many cases, it takes a combination of medication, but also making sure you have a therapist, someone you can talk to. That's a part of it. And I didn't go to therapy for several years after I started treatment with medication. But I found that the therapy really did improve my ability to cope. When I could sense the depression coming over me, I began to learn cognitive behavior therapy type of responses, things I could do to change my way of thinking that would not get rid of the depression, but it would help alleviate the symptoms somewhat so that I could function. And I've gone through over my lifetime many different treatment modalities, and some of that has to do with side effects of many medications. And that's one of the things that will also be individual to each person. Even some medications that work may have side effects that will cause a person to quit taking them. And that has been my experience for those medications that worked. Sometimes I've had to quit taking them and we've had to try something different. But the third component was medication therapy, but also trying to build a social network of people who shared in my illness, shared either with family members or themselves having suffered depression or been a caretaker for somebody with depression.
Yeah, very important. So what I'm hearing you say is one size does not fit all, but a specific size for every individual patient is creatable with the help of your clinical team. You talked about working with your therapists, perhaps even changing medications as is important, either to get better effect from the medications or deal with side effects. That is such a great lesson for us to remember, that one size does not fit all. But if you work with your healthcare team, then you really can find just the right size for you. So that's such an important lesson that you're sharing with us. And finding someone that one is comfortable with is very, very important. It's also important to remember what Marty said about side effects. Not all medications have every side effect in the book, but because we're so individual, if there is a side effect, the ideal thing to do is to not suffer with it in silence, but to approach a healthcare provider and find a solution. And some of the common side effects that can happen with antidepressants that we would like for you to be aware of, dear listener, are things like nausea, diarrhea, constipation, perhaps even change in appetite or weight gain, fatigue, tiredness, sleep problems, drowsiness, dry mouth. You can also have trouble with concentration, memory, that can also worsen. How about feelings of jitteriness, agitation, anxiety, and even sexual side effects? Now, that was a rather long list, and I don't want to worry folks too much, but I think people do need to realize that medications can occasionally or frequently cause side effects, and the best thing to do is to not stop the medications, but work with your healthcare provider just the way Marty is telling us. He's really giving us a masterclass on how to create a team effort with our clinicians. So Marty, did you also talk about any specific lifestyle changes or other treatments with your healthcare provider? I sure would love to hear more about that. And how has your treatment plan evolved with the passage of time?
My treatment plan has evolved, and I would go back to the issue of side effects to sometimes those that start on new antidepressant medications may experience side effects before they experience relief, but don't give up. Sometimes it's best to go ahead and look at treating the side effects for a few more weeks to give that medication a little time to work and to alleviate your depression. And so everything that you mentioned as side effects are something that I've experienced at one time or another with different types of antidepressant medication. So never give up, keep working with the team. There are ways to deal with the side effects to lessen the symptoms of the side effects. But the main thing you want to keep in mind is that there's hope and the treatments out there do work. It's just a matter of finding the right treatment for you. So my treatment plans have changed many reasons. I'm getting older, so maybe that's a big thing. So as we age, our body changes, and there may be something that causes us to react different to certain medications compared to others. The second thing is that we've come a long way since my first treatment with an antidepressant medication. Like I said, that was a first generation medication. We're on, I don't know, the fourth, maybe even fifth generation now of antidepressant medication, as well as other treatments that are available. So there's a lot of good stuff out there. You just have to keep working through it. One of the things that I did have to change, you cannot drink alcoholic beverages. And I've been there, done that. But what we found is that alcohol does interfere with the antidepressant medication. So I've had to give up my drinking and alcohol. In fact, I won't just say drinking, but the fact that in self-medicating, I found out that my family and my genetic history, we have a propensity towards alcoholism. So for me to kick that habit of self-medicating, I ended up going into substance abuse treatment to overcome what had become now another problem. I took depression and made it worse by adding alcoholism to it. So after dealing with that, and now after being 12 years free of drinking and alcohol, I've been much more stable and able to maintain a stable work environment and to show up for work on time, not miss days for being hungover or not miss days for being depressed. So all of those are good things. I continue to see a therapist as needed and check in with my care providers regularly. And we are constantly monitoring the situation to make sure that any signs of the depression coming back, we jump on it as soon as we can. My wife's very much informed of my moods and she monitors me, not overtly so, but just to tell, today you seem off, or this week you seem down, this week you're just not very energetic, you're not interested in doing anything. How are you feeling? That prompts me then to look at what may be going on, because others around us sometimes will notice us slipping into depression before we do. So, that has been important to me. Also, building that relationship with my wife so that I can be totally honest with her about my mental health condition.
Wonderful. You're talking about so many valuable components of a life lived in full recovery from major depression, Marty. You're talking about the importance of recognition of the disorder. You're talking about the need to see a healthcare provider. You're talking about taking a medication that is just right for you. And if it isn't, communicating with your provider. You're talking about being in therapy. You're talking about lifestyle changes. And you're also talking about creating a partnership with important members of your social network, like your wife is. You have given our audience members so much to think about, but also given them so many valuable pointers. So well said, sir. I really appreciate it. So all of this does go towards working with your clinician and making the treatment plan that's just right for you. Let's remember what Marty said, one size does not fit all, but there is a right size for you. And because symptoms and side effects may change over time, it's really important to be in ongoing communication with the healthcare provider. And sometimes using a journal or a diary can help an individual track things. Otherwise, during a busy appointment, one can forget important things. And of course, the healthcare provider can then change the medication or change the dose, whatever is necessary. But what it boils down to is customization of a person's treatment plan. So let's kind of summarize. Taking that first step and telling your doctor or healthcare team member something isn't right, and an open and honest communication is very important. The making of the treatment plan that's individualized and created in conjunction with your healthcare team is very important. And of course, not just relying on one element. As Marty said, a life lived in recovery from depression does have a lot of different components. So Marty, this has been an amazing conversation today. And I thank you so much for joining me. And I appreciate you being so open and all the wonderful pieces of helpful information that our listeners can take away from your shared story.
And I thank you for having me and for letting me share my stories.
Absolutely. And I'm sure our listeners wish you the very best, Marty. And thank you to all of our listeners as well. Until next time.